Hello, this is Dr. Do again. This video is still on alphabetic list problems, still on letter S. Today I'm going to talk about the skin diseases, a variety of different presentations and associated with isolated or associated with the systemic diseases. Let me just bring up the emergency situation. Any skin diseases associated with the emergency? Yes. For example, if the skin conditions like bullae, a big water accumulating on the skin, and particularly if that's associated with medications, there's a condition probably is either Stevens-Johnson syndrome or part of toxic shock syndrome. If that's the case, then this is emergency, because this kind of allergic reaction could not just on the skin, could impair the internal organs, so that's the emergency. And also, of course, injury, big or deep injury, that's the emergency. And also the petechia, huge, a lot of the discoloration from the bleeding or cyanosis, which is change color to the bluish. So if that's the case, particularly for those children, that's the case, really it's emergency to see doctors as soon as possible. Could be caused by the medication, could be other causes. Any skin disease you can manage it at home. Of course, you probably do it all the time. A minor bruise or a minor cut, or just the localized rash, without any systemic or without any impact on your life, or a pimple, you just manage at home. So this is about the serious condition associated with the skin. Talk about the skin diseases. It can be really variety, from the infectious or allergic, or the rashes. The rashes could be small or large, or could be there's a pus, or could be just clear fluid, or could be raised, or could be flat, or could be localized, or could be diffused. So variety of presentation for the skin is really sometimes could be very simple, but sometimes could be very complicated, like I mentioned, the Stevens-Johnson syndrome, or the part of toxic shock syndrome, so which means the skin presentation could indicating severe systemic diseases or internal organ damage. So what are the signs? What are the associated with individual diseases? Probably you already know it. First of all is allergy from eczema or to the hives. Variety of presentations, or the contact dermatitis from wearing a necklace, or cosmetic chemicals cause those localized either small pimples or the blisterings. So if that's the case, you can try manage at home. For example, those it's caused by the cosmetic chemicals. You don't have it yesterday, and today you bought a new one, a new product, and you try it, and then your face swelled or had rash. If that's the case, stop that irritant right away. Do not use it anymore, and talk to your physician. And if it's severely swelling, probably you need to see them. If just a couple of local rash, you probably can observe for a couple of days. If it's not getting better, you need to see your physician. So this is, and the other series like hives, part of the hives, eczema, associated with the mechanism of contact dermatitis caused by the cosmetic agent or the hives is different. It's a different hypersensitivity, and the hives, and it's more serious, or eczema, because by the IgE, immunoglobulin E, which has the vasodilator, could be serious, cause anaphylaxis. But usually these hives, just the anaphylaxis presented in the skin instead of systemic, the blood vessel or the respiratory system. So if that's the case, you can try, but it's quite bothering, the itchy, and also those hives, those just never probably diffuse, but they don't come the same place. So one rash disappeared and started the other area, the other rash. So these are the, and in terms of the prevention of those kind of allergies, seasonal, and also sometimes there's no known what is the allergens, what is the cause for this kind of reaction. If you have had it before, they just need to be cautious along with the season, along with the food, and also the clothing carefully. So that's the only way to prevent. Or you can see your physician, see your specialist. They will do the test, variety of antigens to see which one caused this reaction. If that's the case, then you know specific what is the cause for this reactions. And the other serious condition could be serious is the skin infections. Probably start from very simple local hair follicle inflamed or diffused, or there's an abscess, pus associated with that. But usually the bacteria is the stuff which the normal flora on the skin. When there's a minor cut, or when under stress, or when there's a dry or humid air, so cause this skin infection. If it is small, you can just use some antibiotic ointment from the over-the-counter. But if it is becomes red, large area, expanded area, and also especially if it's fluctuated, which means there's some pus inside. If that's the case, you need to see your physician either to treat with systemic antibiotics or to surgical drain those pus. Otherwise, there's no probably it's not going to heal by itself, or the pus will go down deeper, particularly for those who had systemic disease, for example, diabetes. So if that's the case, you really need to see your physician. There's another skin conditions associated with systemic diseases. I just mentioned diabetes is one, and some other neurological diseases or metabolic diseases. The skin, for example, the hypothyroidism or diabetes, the skin kind of dry and also lost the sense of the peripheral nerve. So the diabetic causes neuropathy. And the infection probably is there, but you do not feel it. So for those people, really, if you're hypothyroidism, skin tend to dry, and apply those lotions with rich of oily lotions and to protect, and make sure do not wash too frequently with the soap. And for the diabetic neuropathy, the skin really, if the infection can really go deep and without notice, without causing the pain, because you thought it doesn't bother you, so you do not seek the medical advice. So like in ancient, I think there was emperor, I don't remember, or king, had overweight, and the skin also never, from the wound, never healed, because of this lack of painful sensation, and also the impaired immune system from the obese or from the diabetes. So if that's the case, monitor yourself closely to make sure there's no infection. So this is about the skin problems, disease. I think this is just superficial or limited. There are a variety of conditions. Some of them could be serious, like I mentioned. So I'm going to stop here and hope it helps. And thank you for watching. I will see you next time.